For those just joining us, we're just waiting a couple more minutes for other folks to join who are also presenting.
Yeah, we'll give it another minute or two, and then we'll check it off, and hopefully other people will join as we go along.
Okay. I know our new juvenile director is going to hop on. She's in another meeting next door, but she'll join us a little bit late.
Okay, good. Glad to hear that.
Was that previously Fromdahl, or is that a different position?
Yes, it was Eric Fromdahl. Now Wendy Lang is in that position.
Let's see, I see we have a chat message from Laura Johnson.
Yep, she's our presenter, and her co-presenter, Annie, it looks like she's having some technical issues and is working on coming on.
Yeah, sorry, I probably could have just did it and said it. So, hi, I'm Laura. Okay. She's working on it. She'll be here shortly. So, and I know you have housekeeping things to do in any case. So happy to be here.
Yeah.
Thank you.
Okay, Corey, are we ready? I can tip this thing off if you're ready. Okay.
Go for it.
Call the meeting to order. Call the meeting to order at 11:32, it looks like. First order of business is to approve the minutes from our May 27th meeting. Do I have a motion to approve the minutes?
I'll make that motion to approve the May minutes.
Thank you, Janelle. Do I have a second?
I can second.
Thank you, Dane. Motion made and seconded to approve the minutes from May 27th. All in favor, either raise your hand or say aye. Aye. Anybody opposed? Okay. Passes. Thank you. As we go along here, Corey puts down everybody that's in the meeting, so I'd like everybody to identify themselves so it helps Corey get through who's attending. So I'll go along my computer and ask people to identify themselves. We'll start with Janelle.
Janelle Kohler, Housing Authority of Douglas County, Executive Director for the Housing Authority of Douglas County, and I also help facilitate the local HTAG meetings, which is a group of partnerships of several community partners that are helping address housing and homeless concerns and trying to just overcome some of the barriers that we have out there. So.
Thank you, Janelle. Dane?
Dean Zahner, he, him pronouns. I'm Southern Oregon's prevention manager with HIV Alliance. I also am a member of the HTAG group, also help coordinate the Connecting Point Initiative and the leadership team, and part of DART. Good to see y'all.
Thank you, Dane. Shelley Briggs.
Thank you. Shelley Briggs, Lewis, City Council, Homeless Commission. Happy to be here. Thanks.
Thank you, Shelley. Cecilia. I think you are muted.
Oh, hi there. I'm with Pisa Home. I'm the Health and Housing Coordinator, still learning about my position and doing my best to help.
Thank you, Cecilia. Ellen?
Ellen O with the Juvenile Department.
Thank you, Ellen. Debbie Hollander.
Debbie Hollander, Community Engagement Coordinator with Umpqua Health.
Good deal. Thank you. Annie Hers from our presenter sponsors.
Yes, hello everybody. I'm Annie Hers. I'm the Executive Director of Sponsors and look forward to sharing with you in a bit.
Okay, thank you. Kim Gandy.
Good morning, Kim Gandy, Overdose Prevention with Douglas Public Health Network, and I also facilitate the Drug, Alcohol, and RX Task Force here.
Very good. Thank you for joining. Christina Donahue.
I am the program coordinator for Hope Drug Court.
Very good. Thank you. Laura Johnson, also with sponsors.
Hi, everyone. I'm Laura Johnson with Sponsors, Director of Program Development. Happy to be here.
Thank you. Kim Gandy. Did I already go? I went through Kim already. I'm sorry.
I did. Thank you.
Yeah. My computer jumped around on me on the monitor, so I lost my place. Robert Wilson.
Yeah, Robert Wilson. I'm with Douglas County Circuit Court with the coordinating for the mental health court and aid and assist.
Thank you, Robert. Julie Zuber. Is Julie with us? Maybe Julie's away from her computer for the moment. Alicia.
Hi, Alicia DeVogue from Cow Creek. I'm the Tribal Intensive Care Coordinator in the Social Service Department.
Thank you, Alicia. Barb Hofford.
Hi, I'm sorry. I'm Barb Hoffert with Douglas County NAMI, National Alliance on Mental Illness. Thanks for having me.
Thank you. Chad Campbell.
Hi, Chad Campbell here with Boulder Care. I'm a community engagement liaison. Happy to be here.
Thank you. Chelsea Gregory.
Hello, Chelsea Gregory. I'm the Behavioral Health Program Manager for System of Care at Umpqua Health. Thank you for having me.
Thank you for coming. And according to my screen, that's all of us. Isn't that correct, Corey?
I believe so.
Okay. Well, we've identified everybody, and Corey has a list of who is on the meeting right now. So we'll go to our next part of the agenda, which is the connecting point update. And Dane is going to give us his update.
Absolutely. Thank you. 1 second. I can share it and it might be easier to read. So we had 339 total services and 112 male, 227 female. We did get some ages out of 103 clients. 37 were 18 to 30, 31 to 50 were about 40, and 51 to 64, 25, and one client identified over 65. We had 117 that had an ID, 67 male, 50 female. When we unduplicated that, there was actually 100 people, 100 unique individuals, 57 of them being male, 43 female. We got 140 showers, and we are able to unduplicate that, and it broke down to 112, so multiple people took showers multiple times. Services, number one item, 137 wound care kits, naloxone, 116, hygiene, 64, socks, 35 clients, 32 condoms. Next services, which are only provided at authorized private property, we did 32 clients. And then food and water, 28. Smoking provided only at authorized private property, 26. Fentanyl test kits, 21. Pet food, 10. Testing, that's for HIV, Hep C, and syphilis. We provided 9 of those. We did implement in May. The city of Roseburg asked us not to do next services in Roseburg Park or on city property, so we did implement that. But we have been doing collection as we committed to. We collected 201 syringes. Carly and the team goes out on Mondays and Thursdays when they're engaging with people in Gaddis trying to collect syringes. About 29 sharps containers. Successes. We did start a Read Sport event this month with the Connecting Point Initiative. We're really excited. It's once a month. We did have to transition around a little bit, and Umpqua Bank actually offered us a location for the last 2 times, and we got a new parking lot of a car dealer, and we're working with Lower Umpqua Hospital to possibly use their location. But I'm just happy. We're seeing a lot more people come to the duck pond for showers. I just kind of use that as a gauge on the shower number, and so it's good to see people coming back there. We're going to do some outreach over to Albertsons, where a lot of people are kind of car camping, and communicate that message of the shower resource. And then Amaker Park, the Sharps box and the naloxone. We did about 40 doses. You don't really know the outcome of the naloxone. And then we did pull that syringe, and there were 350 syringes in the wall-mounted box there. So good things are happening with the Connecting Point initiative. The shower team's getting me the data every time they do showers, and then a couple of the peers are getting me some data. And so it did update a little bit, and we're sharing this at the Homeless Commission just to kind of give them an idea. It was something we thought about, and Connecting Point and the H-tag is just helping support the Homeless Commission with our numbers that we're collecting out there on the street. But I think we're doing a great job. Any questions?
I have a comment, Dean. I think you are doing a great job. I am very, very happy that you're doing what you're doing. On the age breakdown, is that pretty much normal as far as you can tell? Do you do that every month, or is that something you don't do all the time?
One of the peers is actually, I mean, it would take me a lot more time on the unidentifier. I haven't been going through the ages because it's a little complicated to pull the ages out of the unidentified or the identifier we use. But a couple of staff have been getting me on their forms that age breakdown that don't have necessarily the ID. In a perfect world, we get an ID from every person. We could unduplicate all that information, but I think, shows that total services, that 339, there's probably a lot of duplication, but when we actually break it down with the duplicator, we get all 339. It's just a little bit more complicated, but I think we're still serving a lot of people.
You bet. And that's an excellent program. Any questions for Dane? Thank you, Dane. Moving forward to behavioral health updates. And I think you said Corey Sherrill was not with us today, so you have an update, Corey?
Cheryl is off having fun, it looked like in Greece. So, and all she had sent me is because I had an impacts meeting on the 19th, and so I only have the impacts information from her at this time. So we're not going to provide the other ones today. So she said so far in Q2, Impacts, which is our mobile crisis program, has provided, get my glasses on, 828 services during 461 encounters. As of 5/1, there were 712 people in the cohort. So that number keeps going up each time she reports. With that, 189 cohort members currently meet the 4 or more incarcerations within 1 calendar year criteria. These 189 cohort members are the focus of their outreach services right now, and there have been 66 jail in-reaches. Their outreach navigator is now able to perform ASAMs for incarcerated or recently released cohort members, ensuring rapid provision of services to facilitate inpatient substance use treatment and referral to lower levels of treatment. So the only other thing that she mentioned is that they used to have outreach navigators assigned weekend coverage to the hospital. So she said currently outreach navigators were assigned weekends where they would respond to collective medical notifications for new unseen cohort members who present to the hospital between the hours of 8 a.m. and 5 p.m. Saturday and Sunday. In the last years of Saturday and Sunday coverage, there have been 321 admission of cohort members on Saturday and Sundays. Of those 321 admissions, 95 occurred after coverage hours, and 54 occurred for members who were already actively working with impacts. 84 admissions occurred out of the county. In total, there was only 1 successful outreach that had occurred during that weekend coverage. Her point with that information is that Dr. Brigham was on our impacts committee meeting and so was Cherie Barnstable, so the two upper management there. And it was decided that they're going to stop that coverage for now to see how it goes, since they only had one successful outreach from those. And a lot of it was occurring outside the normal hours that they'd have someone. So it's costing more money to keep people on call for times that they're not being utilized. And so they want to use those funds to help them out in other areas of the program to boost other services. If they see that need coming back, then they'll definitely look at that and provide that coverage again. But at this point, someone asked in that meeting if that would impact anything with the hospital, and we were told no. So that's all I had for her report.
Okay. So the coverage they're dropping is the overlap coverage? Is that what you're saying?
It's just an on-call coverage. So if someone were at the hospital during those hours from 8 to 5, they would have an outreach navigator that could go there to the hospital and work with them. But they're not really getting people during that time. A lot of it is either out of the county or outside the normal hours. And so in that case, they have other services they can utilize for that. So it didn't make sense to keep 2 people on call each weekend if they're not really being used appropriately.
Okay, understand. Yeah, I understand. That does make sense. Okay, they have, but there are other avenues of help there even without the impact group.
Yeah, and we still have our 24/7 mobile crisis service, and that's fully staffed, and that hasn't changed at all.
That's good. Yeah, mobile crisis is something I think has been very, very successful. So very good. Or thank you, Tori.
Yep.
That's the update from Adapt Integrated Healthcare. Lindsay Holcomb is not here from Mercy, so we'll have to skip that part of the behavioral health update. But do we have anybody else that has anything to add to our behavioral health updates?
At this point, anyone could speak up from any other agencies if you have something you want to share about your program.
Yeah, I will.
Okay,
Tomorrow.
yeah, go ahead.
Okay, we're hosting
Go ahead, Debbie.
a share cafe tomorrow at the Winston's Community Center from 3 to 5. I know a lot of people here are actually already signed up, but if you haven't, you can still attend. We're going to be presenting information about the share grant, our 2026 share grant. We've got $1.6 million to disperse. I can put the link to sign up in the chat, and it's got all the information, but if you can't attend, that's okay. By July 1st, we're going to have all supplemental information on our website. And if you ever have any questions on how to apply for a grant or what the requirements are, you can always reach out to the community team, and we're here to help. And that's all.
Okay. Run that by me again, Debbie. I caught it. So you said tomorrow, 3 to 5?
Yeah, it's tomorrow, 3 to 5 at the Winston Community Center. You can still sign up. I'll put a link in the chat. I know it's kind of, if you haven't heard about it yet, it is kind of late notice, but again, we'll always have all the supplemental information and everything, information everybody needs to know on our website by July 1st. So.
Okay.
Can't make the meeting.
Very good. Thank you. Yeah. Very good. Thank you. Anybody else? Okay. Cool. Moving forward to the housing. Oh, excuse me. Barb, did you want to say?
I was going to ask Corey if it's appropriate to share this or not, but we had a contact from someone who's in the drug court to do a project and wanted to do a walk for mental health awareness. And we've scheduled this on the 26th of July. We're going to have a walk in the park called Together We Heal. And we just want everyone to know it's going to happen. And we're so excited. So thank you.
Thank you, Barb. Yeah, 26th of July. Very good. Okay.
Right. Thanks.
Okay. Moving forward to our housing updates. Janelle, you have something for us?
Yeah, under the Housing Authority umbrella, it's been business as usual. Our Section 8 program is essentially on hold right now as we go through our process with attrition on our vouchers, waiting for some to come available. Again, we have a portfolio of housing throughout the county. Just encourage individuals to take the opportunity to apply for as much housing as necessary due to the wait list that can vary drastically. So they can always decline when they get to the top if they no longer need it. But we do have those resources out there for housing that can be found on our website. Switching to the H-tag update. So again, H-tag is a very grassroots type of partnership between several agencies, many of which are on the call today as well. And we last met on May 28th and shared resources, shared updates on grants, like, you know, what Debbie was just sharing. So it's always really good to be networking with that group. One thing that I was impressed upon was we had a member concerned about some increasing activity in the Albertsons parking lot, and within 24 hours, teams, based on what we shared at that meeting, had gone out there in response to those concerns and had shared an update that notices had been given to people that were camping in RVs, and that they were able to speak with most of the campers and gave them some supplies as well as info on local resources, food, medical help, and places where they may be able to go. So I was just really impressed with the response to that and how quickly they mobilized and got people out there to try to help address the growing community concern with what was going on in that parking lot. So thank you for the community members to that as well. Then in addition, there was a housing summit down in Grants Pass on June 11th. Yeah, June 11th. And it was a good housing summit. They had breakout sessions, different panel speaking. They talked to, there was ways you can network and learn about community land trusts, talk straight to representatives from Oregon Housing Community Service about the ORCA process, which is their development pipeline process for funding, talk about the challenges of development in today's day and age, especially in rural areas. They had some classes on, this one I wasn't able to attend, but would have loved to, the intersection of homelessness, mental and behavioral health care, and supportive housing services. So it was nice to see that summit occur. I thought it was put on very well, and it was a good resource. So hopefully some of you were able to make it down there and see that. That's my updates.
Thank you, Janelle. Any questions for Janelle? I had a comment. I went to the League of Oregon Cities meeting in April. I think it was April. My months run together too. Anyway, from talking to people and listening to the comments outside of our area, every town or city in Oregon has housing problems and affordable housing problems. Let's put it that way. Well, housing problems in general, but affordable housing for sure. So I understand the need for a great deal of interest in this problem and what we need moving forward. And I don't know that it's ever going to be solved, but at least we're trying to manage it. So anyway, thank you, Janelle, for that report. And I think the intersection between housing, unhoused, and behavioral health and other issues with drug use, maybe all those things come together at the same time to cause the problem. So any other comments or questions for Neil, or anything else about the housing updates? Okay, thank you, Janelle. So Corey, I'll let you introduce our community presentation.
Okay, so in March, Christina Donahue and Robert Wilson and some other folks on our teams from court attended the Criminal Justice Commission Summit up in Salem. And we got to hear some information about Sponsors Inc., which I was very impressed with. So I quickly reached out over the next few months after that to see if we could get them to come on board to talk to us here locally. I talked with some on the phone and kind of went over what services and programs we have here just to help them out a little bit, because we are quite different from the Eugene area. They're a lot more populous than we are, but I think they still have a lot of great information to share with us on how they started and how they remain so successful. So who we have with us today is Annie Hertz and Laura Johnson. So I'll hand it over to you guys, and you should be able to share automatically with your presentation.
Great. Well, thank you all so much for having us. And we have about 35 minutes. Is that right?
You can take what you need, and others may have questions to make it run a little longer.
Okay. So what Laura and I have planned, I'm Annie Hers, I'm the executive director, and have been at Sponsors for in my 4th year. Laura, do you want to? Oh, I guess we already. Do you want to say anything about your time at Sponsors?
I can just quickly say I've been with Sponsors for almost 10 years now. I started out directing the residential program for women and women reuniting with their kids, and have since evolved into other areas of the organization.
So our hope is to give you a swift overview of Sponsors. I'm going to take you through the same slides that Corey and others saw at the CJC Summit, because I think we have a lot going on here, and I think it's helpful to just kind of see it all through some nice colorful slides so you can get your head around what all we do, and then we can certainly leave some times for a conversation after that. So I am going to share my screen. Y'all see that first slide? Okay.
Yep.
All right. Well, when we talk about the work that we do, the reentry work, we often start with some data just to ground people in the fact that there are a lot of people in our communities who have conviction histories, criminal records. And part of the reason that we start there is both to normalize that this is, we are serving us, we are serving our community. And there are a lot more people out there with conviction histories than, we might be aware of. And as soon as those criminal records, conviction histories are there, the barriers to a variety of things come up. And a lot of our work is around addressing those barriers. So just some reentry data here. Reentry is really organized around the fact that 95% of people who are incarcerated are eventually going to be released and come back to their communities. And so the kind of reentry work assumption is we can either be there for those individuals or not. And when we are not, the risk of recidivating is quite high. And there are lots and lots of resources that are needed. So these numbers just give us a sense of kind of what we're looking at. So nationally, 600,000 people releasing from prisons this year, 7 million from jails. I'm just going to skip down. I know that this is data points that many of you are very familiar with. About 4,500 people released from prison, are releasing from prison in Oregon this year. And I think many of us are also aware that about half of the people releasing from state prisons in Oregon are releasing to homelessness, which becomes a really important data point as it relates to our work. And people experiencing homelessness are 11 times more likely to face incarceration. So we can see that there's a cyclic relationship there. Sponsors has been around since 1973, so over 52 years. And not only is that an interesting data point, but I also want you to keep that in mind as you learn about all the things that we offer, because this has been an evolution over decades. The amount that we have to offer here did not happen overnight. So we were started by a group of community activists who recognized that there were, at that time, men coming out of state prison who were releasing to homelessness with no prospects for work, no prospects for housing, and no healthy community to come back to. And so this group started supporting them in these ways and called what they did sponsoring these these men. And that's where our name comes from. So that was in 1973. 1988, we began providing housing and started with 5 beds. And fast forward to today, we have 11 sites with over 235 beds. Of about half of that is transitional housing and half of that is long-term housing, and all for individuals who have conviction histories. We're based on the philosophy that people can and do change, and that strategic interventions at the right moments can serve as a catalyst in that change. And we see that here every day. So as I said earlier, our programs and services are really organized around barriers. And so if we had more time, we could have a conversation here, but I'll just name, you know, that the 2 most obvious are barriers around housing and employment. And then there's also lots of other barriers that we address, whether it's, you know, behavioral health needs, addiction treatment needs, technology, you know, lack of knowledge around the current technology that one needs in order to apply for jobs, apply for housing, healthy community. So there's lots and lots of barriers that our programs and services are designed to address. So our target population are people releasing from federal, state, and county correctional facilities who would otherwise be homeless, and individuals who are also assessed at either medium, somewhere between medium and very high risk of recidivating. And we assess that largely through the LSCMI or the WARNA. We work with a lot of seniors. As some of you might know, there's a lot of folks who are over 55. I just laughed that that's the definition of seniors coming out of incarceration. We work with women with children. We have 10 beds that are reserved for veterans, and we have a lot of participants who have physical limitations, disabilities, and mental health diagnoses. So I'm going to share quite a bit about housing because it's, I think for many of us who are in this work, it is easy to agree on the fact that housing is really the foundation of stability. And without it, it's really hard to engage with the other opportunities and challenges that one is faced with at the moment of reentry. So we have, I'm going to talk to you first about our transitional housing program, and then talk to you about some of our long-term housing properties. And as I do this, I want to invite you to pay attention to the images, because we have a value at Sponsors around beauty, around aesthetics, and the message that communicates both to participants, to our staff, and to the community as a whole. The importance of communicating that, you know, folks coming out of incarceration are worthy of living in a beautiful space, and then we have people from the community who really appreciate the work that we do, and it's easier for the community to appreciate the work that we do when we're doing it in beautiful spaces. So we have 2 transitional housing campuses. We used to call them the men's campus and the women's campus, but because there are more and more people coming out of incarceration who are either transgender or non-binary, we changed the language so that it's not as binary, and folks can come out and learn about our campuses and identify which campus is going to best meet their needs. So our transitional housing campuses have together 119 beds. They're staffed 24/7, and we provide some robust wraparound services that I'll briefly talk you through. And then we also have 115 long-term housing units in Eugene that are a combination of larger apartment communities. We have one that has 54 units, one that has 28 units. We're about to build another one that will have 52 units. We have 10 tiny homes we own 6 houses, like single family homes that are organized in a house sharing capacity. So it's a variety of types of properties for our long-term housing. So these images are of our Roosevelt Crossing campus, which is where Laura and I are right now. It's kind of considered our main campus. Our offices are located here, and this is also where men live in transitional housing. It was built in 2010. We have 45 rooms with about 84 beds for men. And the stay here is between 60 to 90 days. As I mentioned earlier, 10 of those beds are dedicated for veterans. This was funded, for those of you who are interested, by low-income housing tax credits, significant VA grants, and private foundation grants.
I'm going to jump in real quick, Annie, to add that our local housing agency served as the developer on the project. So without that relationship, I'm not sure that we would have had the capacity to go in for that the LIHTC funds.
Yeah, thanks, Laura. And the community that we are right at the end of the legislative session, and I think we might be getting the LIFT funds that we have requested to build another apartment community, and that is also in partnership with Homes for Good. So our downtown campus is where women live. This has 3 buildings. We have 24 transitional beds here. The stay here is a little bit longer for women. We just find that it takes longer to, sometimes because some of these women have kids, and kids just make everything a little bit more complex. In addition to observing over time that it's easier for men to get higher paying jobs, and sometimes it takes women longer to save up enough money to transition out of our downtown campus and into long-term housing. The building here that you see looks purple in the middle picture and blue in the bottom picture. That's Bothy Cottage, where we have 5 units specifically for mothers with children. And we have a lot of our services spend some of their time on the downtown campus to make sure that women have those resources and services available to them. Okay, so I'm shifting. Those are our 2 transitional housing campuses. I'm going to show you now some of our long-term housing. This is called the Oaks at 14th, and this is the 54-unit complex that we built in collaboration with Homes for Good and Lane County. It's permanent supportive housing for men and women. So we have a staff person who spends some of her time there to support tenants. They are all single occupancy units. So we have found over time that whenever we build our own housing, whether it's the tiny homes, which I say ours, it's owned by Homes for Good. We're the service provider. But we build single occupancy units because our relationship changes and becomes a landlord-tenant relationship. And so we can't have a time limit by which folks have to move out. And so limiting the number of people who can live in each unit to 1 person encourages turnover, which we actually want, because we want folks to move on to what's next, and we want others to have the ability to enjoy these beautiful spaces. It's just some images of the apartments themselves. They're really beautiful. These are our tiny homes. And this sits just adjacent to our Roosevelt Crossing campus. Again, there's 10 apartments. This was completed in 2020, just in time for COVID. And again, this was actually largely private funding with a significant Lane County grants and some other foundation grants. And these are some pictures of the inside of the tiny homes. The 2 on the right are the units themselves. And the picture on the left is a community space that is for the tenants, with a full kitchen, living room, and a dining space that's used quite frequently. So that's not all of our long-term housing, but gives you a sense of what some of it looks like. So we talk a lot about offering wraparound supportive services, and just want to give you a sense of what we mean by that. So our transitions program is our transitional housing program. We start by providing the basic needs of housing, clothing, bedding, food. And everybody in our program, everybody's on supervision with parole and probation, which is conveniently located right across the street from us. And because we are in daily contact, that really makes it easier. Everybody here has a case manager that they're connected with pretty much right away when they arrive. And that's their person who kind of both supports their goals and checks in with them on a regular basis and holds them accountable for engaging in ways that are consistent with the expectations that are laid out at the beginning of their stay. This is also the person that does a number of assessments so that we can identify what are their highest needs, what kind of programming is going to best meet their needs. The expectations that we have in our transitions program, that we are a drug and alcohol free environment. And so we do UAs a couple times a week. We expect people to follow a number of rules and guidelines. And we really support people in staying consistent with the conditions of their parole or probation. And again, we have support staff available 24 hours a day, 7 days a week. We also have a mentorship program, which is a really cool program. And it's one in which we bring together trained volunteers from the community, some who have lived experience with incarceration and recovery, but not all. In fact, that's how I started my relationship with sponsors. And connect them to sponsors participants who want to be part of the program. It's voluntary. And the match often begins when the mentee is still incarcerated, and they do usually every other week. They have a video call, start to get to know each other, so that when that person is released, they already have that relationship established. So the lovely thing about the mentorship program is that in addition to cultivating that one-on-one relationship of friendship and support, there's also this whole community that is developed within the mentorship program. And so part of the goal is for folks to either learn or remember how to enjoy themselves in healthy ways, and what it's like to have a healthy community to spend time with. And the program coordinates a really robust array of activities and opportunities in the community, again, to engage in fun things that folks may never have done before. So there's outdoor activities, trips to the beach, hikes, canoe trips. There's art activities. There's free tickets to the theater. We have a group that loves to go golfing. So lots of fun stuff going on there. And it is available to anybody in Lane County with a conviction history. So you don't have to be living at sponsors to participate in that program. We also have a reentry resource center. The two main things that go on in there are employment support and long-term housing support. So employment support is everything from getting help writing a resume, doing interview practice. We keep an updated list. It's updated every day of second chance employers and related job openings. We have funding to provide work supplies that people might need, whether it's work boots, safety gear, or other things that are required for a job that they might be getting. We do a weekly participant orientation. So we do a number of workshops and clinics, interviewing skills, technology. We have a relationship with the University of Oregon where law students come in and we do a law clinic. We do a credit repair workshop. So there's a lot going on in there. And then we also have folks who support, who as soon as participants are employed, then we kind of shift gears and start working with them on their plan for long-term housing. So we help our participants put together housing packets, letters of support, letters of explanation, all of that kind of stuff. And we sometimes do have participants who want to go back to school. So although we don't do a lot around that, we do help participants get connected to whether it's somebody at Lane Community College, and help them fill out the FAFSA, stuff like that. So those are kind of the three areas of work that go on in the Reentry Resource Center. We also have a health and wellness team where we have a peer wellness specialist who support there's a lot of really critical stuff that goes on here, because again, there's a lot of people coming out of incarceration with significant behavioral health needs, addiction treatment needs, and medical needs. And so we connect people to OHP, we connect them to primary care providers. We have sorry, I'm blanking on the word that I need. We have specific providers in our community who we know and trust, whether it be dental care or behavioral health treatment. And we can take people to appointments, support them in staying consistent with their medical plans, making sure that they get to group, whether it's treatment programs that they might be a part of. And we also partner with a treatment program in town. So we actually have on-site addiction treatment programs. Then we also offer cognitive behavioral therapy groups that take place on our campuses. So what does successful program completion mean in our transitional housing program? It means that folks have identified a consistent form of source of income. And most typically that's finding a job. Sometimes that is connecting with benefits. And sometimes that is going back to school and getting financial aid. It means that folks have found longer term housing, that they've stayed in compliance with both our program rules and the conditions of their parole or probation, and that they're alcohol and drug free upon program completion. So we serve, this says 500 people, it's closer to 600 people a year in our transitional and long-term housing program. And if we look over a period of time, just at the transitional housing program, about 60 to 75% of our participants meet this definition of successfully completing our program. So that's the quick overview. Happy to answer some questions either about anything specifically that you saw here that you want to know a little bit more about, and both Laura and I will chime in to answer your questions, or questions about, I think, Laura, correct me if I'm wrong, but when you were talking to Corey, did you talk about the consulting work that we're embarking on? No. Okay. I will just say one of the things that is new for us, we just recently got a grant well, let me back up and say that over the years, starting before I was here, my predecessor, Paul Solomon, who some of you might know, Paul and Laura often provided informal consultations to a lot of communities, usually around the state, who know enough about sponsors to know, like, hey, but can you help us think through what we're trying to do around reentry in our community? And so we are in the process of formalizing a technical assistance or consulting program where communities can contact us and we can give, some I say that because we are, there might be a perspective of that in your community that could be helpful at some point. I'm also, I sit on our LPSCC here in Lane County, and so I'm also kind of, familiar with how that body works. So I will stop talking so that there is time for you all to jump in with questions or thoughts.
Thank you, Annie. You have brought a great deal of information to us that is very, very important. One thing I I actually have several questions. I'll start with, what does your funding stream look like? Do you rely basically on grants, or do you have a permanent funding stream that you don't have to worry about applying for grants all the time?
That is a great question. We do have a number of different sources. As a nonprofit, fundraising and getting grants is always going to be a part of what we do. But we also have a number of contracts, both local, state, and federal contracts, the vast majority of which are local contracts with Lane County Parole and Probation. So it's DOC funding that comes to the county and comes through parole and probation. And because our work is so interconnected, that's where a lot of funding comes from. We also have a contract with Oregon Youth Authority, and we contract with US Probation. So we also have some federal participants. We also have rental income through all of our housing. And so those are the main sources of income.
So that brings up another question. On your transitional or permanent housing, the participants do help with their living expenses?
Yeah, rents are quite low, but anywhere from, gosh, I think the range, Laura, you probably know this better than I, like $350 to
$380 to $925, and the $925 are those beautiful one bedroom units at the Oaks at 14th, and those rents are controlled by Homes for Good, so we don't have a say in that. But the highest for the housing that we own and operate is $550 for those gorgeous tiny home studios. So, and then for our transitions program, so that's long-term housing. Our transitions program, the first 30 days are free. Day 31 to day 60, we charge $1.50 a day for program fees. So $45 for the month. And then if people stay on beyond that, it's at day 61 and further, it's $6 a day. So the maximum is about $180, and it kind of helps people ramp up to the expectation that they will be paying rent. It helps to offset our costs somewhat. The other thing is, I know Annie mentioned that we provide food. So we buy food in bulk for all of our transitional housing participants, and then we stock the shared kitchens. And we are registered as a community buying or food co-op, and so we can charge people for SNAP that use their EBT cards. We charge $7 a day for food. Which offsets our costs. It doesn't fully cover that cost, but that's another way that we can support and have people paying into the program.
Other thoughts or questions?
Is there anybody else that has the question? I have tremendous idea that you have here, and the way that you've gone about it, and the fact that it's started so long ago and you continued through and expanded it. I think your idea of consulting with other communities, counties, et cetera, I'm all for that. I'd like to see it expanded to other areas because it's been successful and it sounds very good. Any other questions or comments for our sponsors group?
Do you guys have OHP assisters there that can turn benefits on for folks?
Yes, we do.
And is Oxford housing a thing up there in the Eugene area? You have that too,
Yeah.
so your model's similar to theirs when you have the group homes?
Our housing is not, Laura, do you want to answer that?
Yeah, I'd love to. Yeah. So yeah, we have Oxford housing is robust here, and I would say that the model is fairly different in that, well, for our long term, I think the closest would be like for our long term housing, where people are in a shared, if they're in a shared home kind of thing. Oxford operates differently in that the different tenants have a say in whether people can continue their tenancy. They can vote people out, and there's a community decision-making process around those kinds of things. We in a very determined manner decided that though we very much want to cultivate community in those residences, different tenants don't have any say in whether other tenants. We encourage people to come to us and report issues, but they are not self-governing in that way.
And I will add that not everybody who goes through our transitional housing program goes to sponsors long-term housing. And there's a fair number of people who end up in Oxford houses that are not associated with sponsors.
Yeah, I mean, we have 1 to 2 vacancies per month in our own housing, and we've got on average, 120 people in our transitions program on a daily basis. So we've worked really hard to cultivate relationships in the community to support people getting access to other housing. And we've learned over time how to support people in requesting reasonable accommodations and how to appeal denials and things like that. So our resource center staff has really leaned into housing access in the last couple of years.
That's great, thank you.
Okay, wonderful. And the one thing that you mentioned right off the bat that really sticks with me is the fact that unhoused people have a much higher rate of incarceration than housed people.
Yeah.
It just shows how much we need housing.
Indeed.
Excellent point. Okay. Thank you very much. Excellent report. Going forward, Corey, do you have something else for us?
I know we're close to time. I can fly through this real quick if you want me to. Let's see, let me find my PowerPoint. So last time when we met, I mentioned some grant updates for the overall programs that I help coordinate. Impacts was the one I was most concerned about. This just shows all in the blue shading, or all the folks that participate in Impacts, which is our mobile crisis grant. Right here it's showing Douglas County. We have most involved are through criminal justice, emergency department visits, and then we have about half of them with the Oregon State Hospital. So back when I reported last time, we were unsure where funding was going to be. Altogether, there's 11 counties and 5 tribal governments that are part of Impacts, and our project period was supposed to end at the end of this month. 5 of the programs, which were 3 counties and 2 tribal groups, one of them actually Cow Creek, had expended all or almost all their funds, and so they were pulling some money from the unallocated funds to help those 5 groups extend their projects to the end of December, while the rest of us had enough funds in our accounts that were going to carry us to December as well. So we just received from the CJC, they're putting through 2 House bills, which before I hadn't had that information and I was concerned nothing was going through, but they're pushing through 2 right now, which is asking for an additional $10 million to be appropriated to the Impacts program. And with this, the decision-making authority will go to the commission for this next year, effective July 1 of 26. I'm not going to read through all this because it's a lot of words, so I'll send out the PDF copy. But on this first bill that they're putting through for the $10 million to make it just part of their normal expenditures, this is actually in the governor's office. I checked this morning, and it's awaiting for signature. on the second piece of the bill, it's at the Senate desk waiting for third reading. So it's still trying to get through both pieces. I believe they need both pieces to make this work, but from what I'm hearing from the CJC, it sounds like they're pretty confident things will move forward. What this means for us, that I got my email with a 4th amendment to our contract, and I sent it to the Board of Commissioners office, which I'm going to their meeting tomorrow morning where it's on the agenda for them to approve. Once they approve that and sign it and get it back to me, I'll send it back to the Criminal Justice Commission, and from that date forward, our contract's into effect to extend it to the end of December. Right now, we have just over 1.5 million left to spend down. And as Jerry mentioned in our last meeting, a lot of that is going towards infrastructure for their new facility, which they haven't started yet. So their new facility is going out Diamond Lake Boulevard, just past where the Sobering Center is on the left side, past the bus depot area where they store their buses. So once they get the groundbreaking started on that property, which was originally going to be June 6th, they're having some delays with some of the permitting. Once they get that all lined out and get started, then they can start expending down that big infrastructure piece that they have on hold with us for the impacts grant. So I'm excited about that piece. And I know that was really fast, but if people want to read about the bill, I'm going to send the PDF. I just wanted to share the good news is that, yes, it looks like we're going to be able to keep the mobile crisis intact moving forward. We may not have as much as we got this last time, but it's still going to help us keep our program robust and moving forward. And the other little piece I had to share, let's see if I can pull that up. Just real quick, as Barb Hofford mentioned, we have community projects that I'm working to get out. I'm working to get the press releases finalized to get to Christina Donahue to review and send out. And some of the projects real quick, we're benefiting DHS Child Welfare Division. We have a participant that's gone through some similar things herself, and it's important for her to help this program out. So it's a time where parents are meeting in supervision with the kids, and they need small items, or they're hoping to get small items to help with kind of that bonding time period. So we're looking at some small toys, books, color books, puzzles, card games, little snacks. DHS is purchasing a bunch of drawstring bags, so each family will have their own bag that will be theirs. So when they come back, they're always going to have that same familiar toys or items to use when they're there visiting with their kid or children. She's also going to do a car wash July 12 to help raise funds for this at Sherm's. Another project is another person that's benefiting. It'll help out at Connecting Point, and it will help the Opioid Treatment Center. She's going to put together some wound care kits. So she's starting out with a car wash this weekend. And then this is her flyer that's asking for some basic small items for her to put together wound care kits. She's going to get some smaller size drawstring bags that she'll have everything in to provide people that in need. So she'll do a Connecting Point later on in her project period, and all the leftovers will go to the Opioid Treatment Center. We have a gentleman that's trying to graduate that was affected by losing his dogs during addiction, and he really wants to help Saving Grace. And the Humane Society is overrun right now with animals. They have over 100 kittens out in foster care right now when I met with them and this participant. And they go through 40 to 80 pounds of dog food a day in some cases, depending on the size of dogs and how many are there. So he's trying to collect dog and cat food. We didn't put on the flyer, but they will accept if someone has recently lost a pet or had to rehome a pet, and maybe you have some bags of food or canned food for your cat or whatever that you just don't want to throw out or not sure about, they'll take it still. So those items we'll take. The only thing they ask for is no raw or freeze-dried food. That's hard for them to handle. And then Barb mentioned the 5K walk or run. That'll be at Stewart Park on July 26th. There is a little QR code for free registration. There's no charge. We are working to have some t-shirts made that'll be free for participants who show up. We're also asking for any partners in the community to contact me if they want to have a small table there to provide information or goodies or something there prior to the event or when people return from the walk. I know there's also a kids safety fair later that morning, so I'm finding some of our common partners are already involved in that, but we do have some folks that have signed up already. And we've had some walkers sign up too. I think I have about a dozen so far, and we just started to get the information put out there. Another person is helping Safe at Home, which is part of FARA program. This is another twist on when families get reunited and they're back home. So there's volunteers through Safe at Home that go to the houses to make sure everything's safe and good and going smooth. Again, with this process, they like to have items that the families can do together, such as, again, reading books, playing games, you know, coloring. If they know, like well, it doesn't even have to be a single parent, but if there's a dad and a son or a kid who really are into gaming and there's a game they really want, such as like Mario Kart or something else, a lot of times if they have those funds, they might go buy a game so they can help with their bonding period even better for something they can enjoy together. Another one that we have, another gentleman's helping out the juvenile department, which is where I'm housed here at Douglas County. So we have our detention center and we have our River Rock and Rising Light programs. One thing, we do have a small budget to help with some things, but it's not enough to keep things all the time. And when I did a walkthrough recently, we are in need. Our footballs are falling apart, the basketballs are wearing down and falling apart. So there's just some, again, we want to keep minds active. We want to keep them somewhat entertained in a healthy way. So we're looking for some sporting things or board games, card games. And there's a list here. This gentleman's also going to do a car wash, and his will be during the graffiti cruise weekend at Abby's. And then a female participant is doing a car wash on the 4th of July weekend. She lives in Drain, and so she's choosing to do her car wash there. She said there's a rodeo and fireworks show that weekend, so if folks are headed out that way and want their vehicle washed also, she'll be there for that. But then her project is actually to help Crossroads. We've helped them before, but this one's slightly different. She's looking for more items for personal hygiene things, but her push was for outdoor activities. So they need hiking or tennis shoes, and we put some sizes there that are commonly worn by participants there. And they said they can be gently used, so they don't have to be brand new. When I talked to the director, he said other things they always run low on are, you know, underwear for men and women, socks, makeup remover, some other small items. So we have a list there for anyone that wants to help. There are a few things they cannot accept, which I have under the picture on the right, which is any alcohol-based items, mouthwash, lotions of any kind of perfume. And then just a reminder, our graduation is August 26th at Douglas County Fairgrounds at 5:15. We do have 7 participants right now trying to graduate, 5 women, 2 men. And we really, really hope that all 7 stick with it and graduate because we like to see them all do well. Again, I ran real fast, but I'll PDF this too and send it out with notes.
Thank you, Corey. That's, yeah. Appreciate the PDFs when you send them out too. I share them. Okay. Anything else anybody wants to add? You'll have the disposition calls for service on the PDF also, Corey?
Yes.
Okay. Anybody else anything they want to add before we get rid of this meeting and move on? Okay. Our next meeting is July 22nd, same time, same place here. And if anybody else has anything, I will adjourn the meeting. Thank you, everyone, for coming.